Welcome to Reframed, a podcast created to educate, encourage, and inspire parents and professionals. The Gladney Center for Adoption staff know parenting a child that has a history of loss, abuse, neglect, or trauma requires parenting skills and insight to be reframed in order to create a loving and caring environment. Reframed host Emily Morehead and guests strive to make an impact on our world through topics that are important to you, your family, and our communities. And now, here's your host, Emily Morehead.
Hi, and thanks for tuning in to another episode of Reframed. We have our guest Pam Dyson here today to talk with us about reframing anxiety in children. Pam, tell us about yourself.
I'm a licensed professional counselor supervisor and a registered play therapist, and I have a clinical practice in Plano where I work with children ages 3 to 12 and their parents with a variety of presenting problems that parents are often challenged with their children.
Absolutely, and so one of those common problems is anxiety in children. So tell me what signs or symptoms parents typically come to you with, or like the concerns are kind of presenting in their child.
Certainly. Anxiety is the most common reason that children are brought to therapy. So
I didn't know that.
It happens all the time. You know, a lot of anxiety with children is sort of age appropriate and typical. You know, children might be afraid of the dark or monsters or storms, and so sometimes it's just age appropriate. But sometimes it gets a little out of control. And that's sometimes when parents call me is now my child is afraid of storms and they're on the weather app all the time looking to see, is there a storm coming? And, do we need to go to our safe place if there might be a tornado? And so when it kind of becomes an all-consuming worry and you sort of end up navigating your life around things to accommodate your child's fear, then a lot of times they do call a therapist.
So that's typically when they're calling, is that our life is now, we have to change all of our routines, our rituals as a family.
Exactly, and that's really challenging, especially if there's other children in the family, and sometimes then you're missing out on doing fun things together because we have one child that can't do that, can't participate, or is too fearful. So
one of the things that comes to my mind is like the beginning of the school year, right? Like that I'm going to a new class with all these new friends, and you're dropping me off and I'm going to lose my mind because it's so scary and intimidating. So how do we kind of differentiate a new situation versus this could be a chronic persistent problem that's impacting our kiddo?
Certainly, because sometimes it is hard to tell. Is this just sort of a phase the child's going through or an age-appropriate thing, or is it something that's really more concerning? And the start of the school year, new baby in the family, moving, those are all things that are stressful and can cause anxiety even in a child who doesn't typically struggle with anxiety. So sometimes it's kind of common and not unreasonable to expect a child to be a little concerned about the new school year. So I guess what parents can often do is is there a time you can go meet the teacher before school starts? Spend some time on the playground at the school before school starts. Learn to navigate what that will be like when your child gets there so that when the time comes to start school, they're a little more familiar with it. So sometimes parents can put strategies in place ahead of time before something like that happens. But say your child's in 4th grade and this happens every year, then I would wager there's probably some other things that child might struggle with as well. And that might just be one of those. So it might always be new things, things that are uncertain. And a lot of times with anxiety, it is about worrying about the future and what's going to happen tomorrow, next week, a month from now.
So how do we help our kiddos kind of navigate that? If it's something that we're seeing, obviously seeking a professional therapist, play therapist specifically with, a young age range, but what can we do as parents to support our child in transitions that we know are going to be hard for them and provoke some internal stress or anxiety?
Right. Well, one thing is you got to be calm yourself.
That's hard.
Because oftentimes anxiety runs in families.
Yeah.
And if you have an anxious child, chances are good you have an anxious parent.
Yes.
And sometimes maybe what a parent is seeing in their child right now, maybe they had that same kind of anxiety when they were that age. Yeah. So now they're revisiting their own childhood and remembering what they felt like on that first day of school. And so now they're really afraid of how else my child going to manage that because I didn't do a very good job. So recognizing your own anxiety is really key, and learning how to rein in your own anxiety. Because if you have a child who's anxious, in the moment, how are you going to help them get through that moment if you're feeling anxious too? So it really starts with the parent recognizing their own anxiety and what they're bringing to the equation. And then, and so children do better when there's predictability and a routine and their structure, and you talk about, well, first this is going to happen, then that's going to happen. And if there is that predictability and then it goes that way, sometimes that eliminates some of that anxiety.
For them to kind of understand there's this and then this and then this.
Right, because a lot of kids worry about the future. Well, what if this or what if that? Well, I know that could happen that way, but here's how we're expecting it to work out. And if things change along the way, then we'll figure out what we need to do in the moment. Because you can't always anticipate everything that might go wrong.
Yeah, I'm having a mom moment. So recently I dropped off my toddler at school, and his teacher, who knows him very well and our family very well, said, he does much better when dad drops him off. And I was like, oh, this is about me. This isn't about him. This is about what I'm projecting and what he's experiencing, even in this situation. So it's almost even if our child looks anxious, that inward check of ourselves of what are we doing that's maybe inhibiting or prohibiting them to feel comfortable in that situation.
And because there's always a lot of variables to any equation.
Yeah.
And certainly sometimes as a mom, I think sometimes with separation anxiety, sometimes with moms it can be more challenging for kids, and sometimes it's more about mom having a hard time saying goodbye than the child.
I think it was me.
But then the child picks up on it, and then those symptoms of not wanting to be away manifest in the child, when really it's mom going, oh, I don't want to say goodbye to my baby today. Oh, I wish I could really be with my baby. And then sometimes it really looks like it's in the child when it's really maybe the mom.
Guilty.
And it happens.
Yeah.
And so recognizing that. And sometimes in those cases, you might need to consult with a professional who can help you learn how to manage your own anxiety around that and have your own strategies for taking care of that. And there's certainly nothing wrong with what the teacher suggested is maybe for a while until your child gets over this little phase of separation anxiety, or until mom can kind of adapt to it, to let dad be the one to drop off.
And dad rocks it, so we're going with it.
So there you go. So it helps if you got another parent you can tag team with sometimes in some of those cases. Yeah. I think that's really important. So you utilize the support you have around you.
Totally. What if you are if you're parenting a child or you're foster parenting a child who might have trauma? How do we differentiate trauma from anxiety? I'm sure those coexist in a lot of situations.
They really do. So sometimes it can be really hard. But if you know that the child's had a trauma, and if you maybe know some of what it was, then you can probably maybe pick up on what are those triggers. Are there certain things that happen, situations, places that you go that are connected to that child's trauma. So then how can we make those trips to wherever it was we were going, make it a little bit easier, manage some of those things. But anxiety is going to go along with that. So a lot of times it's being calm, have some strategies and tools about maybe deep breathing. Once again, that preparation about here's where we're going, here's what we're going to do. I know sometimes that's a scary place for you to go, but I'll be right there and I'll hold your hand. So telling the child ahead of time, practicing deep breathing and strategies, and talk about what it's going to be like ahead of time. I think sometimes when parents know a situation is going to trigger a child, and that doesn't even necessarily mean trauma, just a situation where a child feels maybe overwhelmed or fearful because there might be people there they don't know, or it's a situation they've not experienced. They don't want to have to they're afraid if they tell the child ahead of time, the child will start worrying about it. So then they don't tell them, and then they just show up there.
I hear that a lot.
Because it's just easier to avoid it rather than prepping the child. But I don't think that's fair to children. Even if it's unsettling to them, well, let's figure out ways you can help them navigate that uncertainty about what's coming, rather than just saying, oh, we're going to get ice cream, when really you're going to the doctor for a blood draw. I be honest with children and learn how to get some help from a professional who can help you come up with some strategies to navigate through that, so you can tell your child it's time to go to the doctor.
Sure.
And I know you don't like to go, and I know sometimes they poke you with a needle, but we're going to have to do that, and I'll be right there. Remember, the nurse always has, you can choose a Band-Aid, and all of those things that help children feel safer, feel predicted. It's predictable.
It's almost like you give them control of what they can. Like, you do get to pick the Band-Aid, you get to pick what we do after but we're also, you do have to go to the doctor. It's both of those things together.
Because you don't want to stop doing things just because it produces anxiety in a child. Because then children pick up on the fact that this is so horrible and it's so awful that we just don't do it anymore.
Yeah.
And that's not a good message to send a child. Plus, then they might start to think, well, I guess there's something wrong with me. Because I know my friend, he has to go to the doctor, and he goes, but we don't go anymore. So maybe there's really something wrong with me because I can't figure out how to go without being so scared.
What about our parents or families who swing to the whole other side of things and they just expose? So like, you don't like going to swim lessons, we're going to swim lessons, here's what we're doing, sorry about it, buddy. And you just like throw them in, and this is what you're doing. I don't advise for anyone to throw their child in the water. But I mean, really and truly, that exposure of here's immediately what we're doing, and we're sorry this is hard, but we don't really care, you have to do it.
Right. That's not really helpful either.
Yeah.
And I think sometimes sometimes happen with children who might be afraid of water or social situations. So let's just double up on all of that stuff and kind of the more we expose them to it, maybe they'll just get used to it. That would not be my best advice to a parent if they asked me if I thought that was a good strategy. I think you need to go slow and go at the child's pace. Or now they might say they didn't like water, and you're like, you're going to swimming lessons, and then like you said, you throw them in the water. There, learn how to swim.
Here it is, ready to go.
Right. Now they might start having a panic disorder and have little panic attacks every time they get near the water. So you might create a bigger problem and generate more anxiety if you don't meet the child where they're at. So if they're not ready to jump in, do you start with wading in the water? Do you start with playing with a little bucket in the water? Start small until a child feels comfortable, and then go up to the next level. It's kind of like graduated exposures to things until you're comfortable with that. It's like a child who's afraid of dogs. Maybe they were attacked by a dog. Maybe they were bitten by a dog. Or they saw somebody else bitten by a dog, and now they don't even want to be around a dog. So maybe you read books about dogs. Maybe you buy them a stuffed dog. Maybe you go to a pet store and look at the dogs through the cages or through the glass. Eventually, maybe you can reach in and pet one, but that might take weeks, months of slowly going at their pace until they feel comfortable. So
it's kind of following their lead even.
It is. You really do have to follow their lead. I know a lot of times with parents, you just as soon move through this phase and go on to the next one, but you can't push kids to do things that they're just not ready to do. So it's recognizing that their anxiety is real and validating that and not dismissing it. Because sometimes parents do dismiss it too. It's like, there's nothing to be afraid of. I don't know why you're making such a big deal out of this. Look at me. Listen to me. Let me tell you why you shouldn't be scared. And that's just dismissing what a child is really feeling. And they need to have their parent or caregiver listen, understand, and say, you're so scared about that dog. I'm so sorry you're scared about that dog. I wonder what we can do to help you learn not to be so scared of dogs.
Because I think sometimes parents are so worried that they're going to play into it. I know that's a bad lack of phrase for that, but really and truly, I hear that all the time from parents. Like, if we acknowledge it, then we're playing into it, and it's going to grow and get bigger, and we don't want that for our child. So they're well-meaning, but it is dismissive. So what are some phrases, or what's best practice in acknowledging but also helping them through it?
Because sometimes as the adult in the equation, you use your adult wisdom and life experience, and you try to rationalize with your child why this is an unrealistic fear.
Like, there's not a monster under the bed.
And you keep saying that. And look, I've looked 100 times and it's not a monster there. So you use your logic and your adult wisdom, because you can do that. You're an adult. And you think your child, because you're the parent, will just listen to you and go, oh yeah, Mom's so much wiser. Mom's been around a lot longer. I obviously just need to listen to her. Children just cognitively, they don't do that. They can't. They don't think we're older and wiser. They can't do that. So really, as a parent, your best bet is to what? Go to their level. We can't expect children to come up to our level cognitively. They're just not able to do that. So we need to meet them where they're at and say, monster under your bed? Well, is he under the left side of the bed or the right side? Where is he? Well, let's look under there. Do you want to help me look, or you want me to look? And so it may sound like you're playing into it, but really you're what? You're validating what they're experiencing. And you're saying, I want to learn. I want to understand. Help me see this from your perspective. And so then you go under there and you look, you go, well, I don't see him. Well, he was there last night. Maybe he went outside. Maybe he'll be back later. Well, maybe he will. Well, I wonder what we can do to take care of him. So maybe you make monster spray, or maybe you come up with a little chant, you know, monster, monster, go away at bedtime, monster, monster.
You've done this before.
Yes, so you're meeting your child where they're at, and you're coming up with strategies that are more child-friendly. Because the odds are good as a parent, if you've been trying what you just mentioned and rationalizing it with them, and you've been doing that for a long time and it's not working, then it's not going to work the next time you try it. Okay. So you're going to have to rethink that strategy and meet the child where they're at.
It's almost, even when I hear you, even with your voice tone and like even your eyes expression, your facial expressions, like you're being playful, but you're not playing into it. So
right. There is a difference.
Yeah. So walk me through that difference.
Yeah, I think it's a learned strategy in a way. Yeah. And sometimes with a parent, that's really hard for them to shift, because parents are all about what? We got a problem.
Go to bed, like, yeah.
Right, we're going to do this, this, and this. Trust me, I'm the adult. This is how we navigate through this. Sure. Just listen and comply and don't worry about it. And I've got a handle on it. We're taking care of it. And just to recognize that children just don't process things and work through things like adults. Children have expansive vocabularies anymore, where they're just exposed to so much more socially, that a lot of times parents think because their vocabulary is so expansive that they must also then, when we explain things to them in an expansive way, that they understand that. And a lot of times they're not processing that information like we would if you were an adult. Yeah. And so just really recognizing that you have to meet a child where they're at and recognize that cognitively they're not able to process that information like an adult. And you know, be there, be present. Just sometimes you just gotta listen. And then when they say, well, but that monster, he's under there every night. Well, no wonder you're scared if he's under there every night. So I wonder, you know, I've heard about monster spray. Have you ever heard about monster spray? Somebody was telling me you can make your own monster spray, and then every night you spray it under the bed.
And that can be this game you guys do together, disarms the fear through that play.
Sure.
I love that.
Sure. And then it's about connecting. And you're not trying to correct your child's fear or make it go away. You're acknowledging it and saying, we can figure this out together, and we can figure out what you need to do, which is what you should do with your child with whatever's going on, not even just anxiety, but with everything. Parents want to fix things, make it right, which is what parents do. Yeah. But sometimes your child just needs to be heard and understood, and have you be present. And then the resolutions to what's going on there oftentimes just come as a byproduct of that.
Do you spray the room forever, or does it slowly go away? What does that look like?
You know, sometimes it just kind of goes away on its own, because now that you've made the spray and mom or dad's acknowledged that there's really monsters under there, and you do it every night, sometimes now the intensity of that goes away, because you're no longer arguing with your parent. Yeah. Or the realness of the monster. Yeah. And so sometimes once that fear is acknowledged, maybe the intensity of it sort of dissipates.
That's really beautiful.
And it does oftentimes. And then you know what, just when you get a handle on that, then it's something else. Because that's how parenting goes. So you're always having to sort of reinvent the wheel and come up with new strategies.
With the monster spray, or like with coming up with these new strategies of, I catch myself, take a breath, buddy, but he's already up here, or, you know, our child's already scared of that monster, it's, 2 a.m. When do we implement these strategies? Is it when they're calm? Is it during? Is it both?
Well, you need to implement them when they're calm. So, for example, if you go through this every night that there's monsters under the bed, then maybe the next day, after nap time, or after they've had a snack, you sit down and say, there's always a monster under your bed at night. And it kind of interrupts our bedtime routine. It's so important for you to get to bed and get your sleep. So I'm wondering, do you think there's something we can do that can be part of our bedtime routine? Yeah. We read a story and we say our prayers and brush our teeth. What else can we do to help take care of that monster. So maybe that's when you could introduce that concept of monster spray. So you talk about it when a child's not feeling anxious, and then you start implementing it as part of that routine. Or if it's breathing that you're trying to teach your child how to do some deep breathing, certainly you have to practice that.
It's not mid-tantrum.
It's not going to work in the middle of having an upset moment. I know as adults too, right? We can't just flip that or switch that off and on. So practice those things, and you don't just practice it once or twice and you're done. You need to practice it a lot. And families spend a lot of time in the car. You could practice those kind of things in the car, right? Make it part of your daily routine. And so when it happens, then what? You can jump to doing that and what? Try to regulate your own breathing so your child can regulate theirs. I found that with breathing. If you as the adult in the equation start really you almost overdo the breathing. If normally if you'd be like, okay, I'm breathing like this. So you kind of make it really and you make the noises that go with it, and the child's watching you or the child's near you, oftentimes they pick up on.
I even want to take a deep breath because you just
they pick up on what you're doing, and so you can sometimes regulate their breathing because yours is regulated. Or if you can hold them on their lap, get them close to your heart. Your heartbeat will help them regulate their breathing, get their heartbeat synced with yours. You can use that in many ways with children, and certainly if there are certain times of the day
that it's hard,
that are harder for them, then you can start putting those strategies in place when you start to see that.
So kind of proactively even beating that worry.
Right, because sometimes you can. If certain times of the day are going to be triggers for things like monsters, and then you already know that. So what do you do ahead of time so that maybe tonight we won't have it won't last an hour. Sure. Maybe it'll last 30 minutes.
Sure. Which is progress.
Right. Any progress is progress.
So we mentioned earlier, a lot of times anxiety can I'm feeling this for moms, so now I'm kind of presenting in this way. So what do we do with our kiddos if we are an anxious parent? Is it something that we hide from them? Is it something that we tell them about? How do we model, we're human too, and we experience worries and fears or stressful situations. How do we model that in a healthy way?
Well, first of all, you got to recognize what your own anxiety is and have strategies that you use to manage it. And I think it's important for children to know that sometimes mom and dads get scared about things. They worry about things. Or to say, when I don't think I've ever told you this story, but when I was your age, I was afraid of monsters under the bed too. And kids will look at their parent and go, really? Because you look at your parent at this, they're your hero, and they do all these great, wonderful things that you can't imagine that they were scared of a monster. And so you normalize it when you say, oh yeah, I have that. Well, what did you do? And then you can share what you did. And so even now today, with any emotions that parents are feeling, I think it's important for children to see that you have that feeling, that emotion, and that then you do things to manage it. The best way to help kids learn how to navigate through things like anxiety is to let them see you having a little anxious moment, and then the strategies that you use to get through it.
It's interesting because on one of our last podcasts, we talked about grief. And so even acknowledging mom's going to go to therapy and work on herself, and it just becomes a normal thing that we're, seeking help and that we have these feelings, and it's almost modeling. You're not having the child absorb those feelings for you or take care of them, but almost that they see that you can take care of them and manage them yourself, and that there's something freeing for that child. They're not responsible for your anxiety or your grief or, whatever that is, which I think is really empowering.
It is. And if you hide your feelings from your child, and then they all at once, they start having strong feelings about something, they might wonder, oh, but mom doesn't feel that way about things, so there must be something wrong with me. So you want children to know that you have feelings, whether, like you said, around grief or whatever it might be. Of course, you want to make sure that what you're modeling, what they see, is something that's appropriate for them to see. If it's more of an adult nature type of a fear or feeling, you want to, like you said, either work with a therapist, talk to a friend, whatever you do to work through your own stuff, because you don't need your child, like you said, to have to step in and feel like they have to calm you down, because that's not a role of a child when it comes to the parent-child relationship.
And sometimes those kids look so calm, and then you just feel their little hearts, and they're just beating out of their chest, but they feel like they can't say it because they're taking care of you in some situations.
Right. Yeah. So you have to be really careful about that as a parent, and recognize when you're using your child more support that's never a good thing. You need to let them be kids. We can't expect kids to play an adult role.
That's right.
They don't know how. And it's too scary to them to feel like they have. And then they feel responsible when something doesn't go right. And kids have enough stuff to navigate growing up with.
It's not easy being a kiddo.
It's not. It's not at all. And so it's really important for parents to understand where their children are at developmentally too. There's a lot of great resources out there. The Center for Disease Control, they have developmental handouts on their website that you can print out for different ages. There's other websites out there. If you just Google child development charts or handouts, you can find that, so that you can look at things, and when your child has a fear of something, to say, is this normal for this age? And sometimes it might be.
That's an awesome resource.
So that you educate yourself on what's kind of typical for whatever age your child is at. So then you might be able to identify early on if something is above and beyond what's just sort of a typical worry.
And then you're not getting a call 3 years later. This has been going on for so long, and it's been, basically debilitating to our family.
Because the earlier you can identify something as needing intervention, then the easier it is to remedy that problem. Early intervention is key. And certainly you don't always have to right away call a therapist. Sure. A lot of parents go to the pediatrician first and say, here's what's going on. Is this typical for my child's age? And a lot of times pediatricians can do a little bit of screening to see if they think it is or not. And then they can certainly refer you out.
And that way we're not diagnosing our child. Because I think that you and I both as therapists have, gotten those calls of, hey, this is exactly what my child has because I Dr. Googled, and that's not helpful.
No, it's not.
It's good to be aware, but there's a balance of trying to practice that in home.
There is. And sometimes just by reading the symptoms of the diagnosis, you can say, oh yeah, that's my child, that's my child, that's my child.
I always think I have all the things
I read. Or we think we have them all, and that might not necessarily be the case. Right. So, and so you really have to be careful with that. Yeah, Google's a good tool, but sometimes then it can be problematic because it might lead us to conclusions that might not be completely accurate as well. So yeah, if you have concerns about your child that maybe the anxiety is above just typical for that age and might be more that it's of a psychological nature and needs to have some therapeutic intervention, then consult with a professional and rule out what's not a problem, and then get strategies put in place to help manage it.
So when we're talking about just kind of having these conversations and setting the stage almost preemptively to that anxiety, one of my favorite things to do is read a book with my child. And we have lots of books on the shelf about feelings, and we can kind of normalize that just in our home, that this is what we talk about. So do you have any favorite reads that our parents should know about, of a really good book to read with their child?
I love the Dr. Seuss book, My Many Colored Days.
I haven't read that one.
Oh, you got to get it?
Yeah.
Because it talks about, different colors, and that some days are blue, and when it's blue, I feel this way. So it doesn't really give a particular feeling to a particular color. It leaves it open to interpretation to the reader.
Fun to read together.
And so it can be whatever you want it to be. And then you could even color out on a piece of paper then, what color are you feeling today?
That's a
great
book.
one.
Yeah.
Comes in a board book version, so if you have young children who like to rip pages out of books,
yes,
get the board book and it'll hold up for a really long time. And then Todd Parr, his books are awesome, the content, but the illustrations, which he does as well, are just
they're amazing.
They're amazing, and they're real simple. But he has oodles of books about families and about worries and being scared and this and that, every topic imaginable. Awesome. And I think he has some new books coming out too in the real near future. He always has new books coming out.
He does, and his graphics and the wording, it's just so beautiful.
So those are great, and they're real simple designs, not too many words on a page. And I think actually though, any book your child enjoys you reading to them, and even once children learn how to read, there's still something to be said for sitting with your child and reading to them, or you read part of it and then they read part of it.
It's magic.
It's magic. And those are the kind of things your children remember someday, are those moments you spent connecting and being attuned. And I always tell parents, make sure when you do that with your child, that reading, and there should be a part of every day you read to your child, is turn off your phone, turn off the TV. Anything that's going to ping a notification, you don't need, because you'll look at it. You'll pay attention to it. And you need to communicate to your child that being with them right now in this place and time is the most important thing to you.
I love that.
Because if you don't make it be the most important, it won't be. And those little electronic gadgets get in the way of that sometimes.
Absolutely.
And so you have to sometimes as a parent be very intentional in saying, our time together is so important. I'm putting my phone in the other room because I don't want it to bother us.
That's a modeling right there.
It is about how people are more important than those little gadgets.
And our relationship is more important than anything that could happen with those gadgets.
Definitely. And some of those anxiety problems, they might kind of go by the wayside
It's the
if we
sweetest part of
spend
my
more
day.
time just connecting with our children and being fully present.
That warm little toddler in my lap reading a book, I mean, nothing is more calming than that moment. It's pretty sweet. Well, Pam, thank you so much for joining us today.
It was my pleasure.
Awesome conversation. You have so many resources. How do our viewers stay connected to you?
Well, if families are looking for play therapy services or consulting services in regards to some concerns about their child, they can go to PamDyson.com. It's Dyson like the vacuums.
Pretty easy.
PamDyson.com, and all the contact information and the services that I offer is all listed on there. And then I also work a lot with mental health professionals, especially mental health professionals who work with children and maybe utilize play therapy. And I offer consulting, supervision services, and continuing education workshops for therapists who are interested in learning more about play therapy. And they can go to dfwplaytherapy.com to find out what workshops are on my schedule, how to reach out for me for supervision and consultation, and all of that information. It's all right there.
Very good. Well, thank you so much, Pam. Pam mentioned several resources today, like the CDC milestone checklist, and we'll link all of those in your show notes so you have all the resources and tools that you need to connect and empower your child through whatever they may be experiencing. Thanks so much for joining us, Pam.
My pleasure.
We'll see you next time.
Thanks for listening to the Reframed podcast. Be sure to visit gladneyuniversity.org to access the show notes and discover upcoming trainings at Gladney University. We'd love your feedback, so please head to iTunes and rate, review, and subscribe. Until next time.